got it more than we did have on campus, but it's still a good way to get to it, and time matters, and all that stuff. So elementary, it's above, AED in the gym and above the AED at the office. So, anyway, what we've gone over, and we're gonna call 911. Okay, this is another, law, or another thing we have to just mention. It is called, it has a training and it has a curriculum, and I have to do the tier 1 training. But this is palliative end-of-life care. So this would be a child in the school setting who is a do not resuscitate. If that were to happen, there's a protocol we go through, we have to call the State Department, it's a whole big thing, but just be sure you are aware of it. And I'm gonna, there is a curriculum, I'm not gonna open it up, but I do have to do the training. Okay. All right, so real quick, it's called the Alex Hoover Act. Again, we would have the tier 1 training, tier 2 training, tier 3 training. The State Department's gonna be involved. We would make sure that everybody in the school would have a responsibility based on this. The nurses are gonna be, you know, you're gonna know about this. We would have a transportation policy. So all of y'all that have a role in this, and then there you go. Anybody have any questions? You know, my prayer and hope would be not to have that, but okay. Next, we have adrenal insufficiency. That is where the adrenal gland does not work. It presents an emergency. Again, we do not have any of these at Locust Fork. It's just where the adrenal glands do not function. They would have an emergency medicine for this. They have to have a dose of cortisol if this happens. It would be caused by injuries and things like that, and it can turn very bad very quickly. Okay. Next is stop the bleed. So all of my teachers have a tourniquet and some things to make a bandage in our bags, and it just, that tourniquet goes on and you pull it and twist it, and it is like for something like a big gash or a cut, or, you know, God forbid, we had a tornado and we had people that were bleeding and things like that. That's where this is gonna come. You know, kid punches a glass window. We may need to know this.
High school's supposed to have one, if they're new teachers and they didn't leave them, they were putting them in the backpack, let me know, okay.
Okay, so after an injury, this just shows the tourniquet. Be sure to put your gloves on. All right, so just, you know, you want to protect yourself. You want to call 911 if they're not already here, and we want to compress, try to get that bleeding stopped. So, the ABCs of bleeding: be alert, call 911, find the injury, compress. And once you start holding pressure, you are committed. Do not let up on that pressure if this is a big bleed. Even for, this is just a little blur, even for nosebleeds, make sure those children are taking 2 fingers, pinching their nose below the bone. They should be able to do that themselves. Direct them to do that, so they are not spreading blood all down the hall for somebody to have to clean up. There is nothing worse than them coming in and they got blood going everywhere, and they're just standing there and they're not holding their nose. I mean, those are things that can be done from point A to get to point B and not make a mess. Anyway, that's a little side note. You know, of course, your safety is first. You can use, you know, something between you and the blood, even a garbage bag. If you lay it on whatever you're using to hold pressure, if you've got a garbage bag or a Ziploc bag and you don't have gloves handy, you could put that on there. And those are just in emergency situations. Of course, we're gonna get help. So this is a deep leg wound, arm wound. So if you don't have a trauma or first aid kit, apply direct pressure to the wound, cover it with a clean cloth, apply pressure. If you do have a trauma or first aid kit, use that. You can apply that tourniquet. Of course, you can't put the tourniquet on the neck, you're gonna have to hold pressure there. And even this recommends taking a clean cloth, such as a shirt or anything you can use, because, you know, if you got a bleed like this, you've got a big emergency. And this goes and shows how to put the tourniquet on. And like I said, ours, they come around and they kind of Velcro, and then you're gonna click that, and it gives you directions too. And it's got a stick on it that you're gonna turn until it gets so tight you can't turn it anymore. And you need to write the time on that you started that tourniquet. So assure your safety, look for life-threatening bleeding. Is the trauma or first aid kit available? It goes through that. Use any clean cloth, apply steady direct pressure directly to the wound. You wanna know if you've got the kit, you wanna know where it is. If it's on the arm or the leg, you can use the tourniquet. If it's on the neck, shoulder, or groin, you cannot use the tourniquet. So the only thing more tragic than a death from bleeding is a death that could have been prevented. And that goes along with anaphylaxis, asthma, that goes along with any of our things that we have talked about.
You can learn how to stop the bleed. The steps are simple, and by learning how to stop the bleed, you can save lives. And stopping the bleed is all about compressing. Basically, we need to find a way to put pressure on that wound to make it stop bleeding. If you don't have anything with you, then you're going to use direct pressure. And how would that work? Let's use our simulated leg here, and let's say this is an injury that's bleeding pretty heavily. I'm just going to put pressure on it with my hands. I might have to straighten out my elbows, I might have to kneel on the ground, I put my shoulders right over my hands, and I'm going to push down fairly firmly and make that bleeding stop. Most bleeding will stop just by doing this alone. Now, of course, once I do this, I can't do anything else. I can't stop compressing. I should not check to see if the bleeding is stopped. If this is working, I'm going to keep doing this until EMS and first responders arrive. Let's say, though, you do have a trauma kit with you. What else could you do? This is an example of a trauma kit, such as we issue during our Stop the Bleed course here at UC San Diego. And there are several things inside here that can help you with stopping the bleed. I'm going to open this kit up, and the first thing we'll find inside of it is a tourniquet. You're also going to find a set of heavy gloves. You'll find a compression dressing. You're going to find a packing gauze.
All we're gonna have
And
is
you'll
tourniquet
find a marker.
and
To
whatever
use the
we've got in
tourniquet,
there to hold pressure.
what we need to do is first open it up. If we simply take two sides and loose and pull, the tourniquet will open up into a nice big loop. In this way, we can put the tourniquet over the end of an extremity simply by putting the large extremity through the loop. Then we pull on the red strap, and you snug this down fairly firmly. If you make this tight at this step, it gets much easier to apply the tourniquet. So we'll put that on nice and tight. We'll bring the strap around up to, but not through the clip yet. Then we'll take the windlass rod and begin to twist it. It doesn't matter which way you twist it. The tourniquet will tighten. Keep twisting until the bleeding stops. The patient will find this uncomfortable, and you'll have to reassure them that this is important to stop them from bleeding to death. Once you have the tourniquet tight enough, you'll allow the clip to hold the rod. You'll put remaining strap through the clip, and then you'll take the windlass strap across. We'll take our marking pen and we'll write down the time of application that we put that tourniquet in. Let's say you've got somebody who has
How long that
bleeding,
has been,
and it's in a place where you can't put a tourniquet on, or you don't have a tourniquet, but you have something you can pack the wound with, and you can do direct pressure. All right, we have our gloves on. Here's our wound. And what we'll do is we'll start to pack that wound with the gauze. The patient won't like this. It's probably going to hurt, and it is kind of icky, but this will enhance the effectiveness of your direct pressure, particularly in those areas that we call junctional areas, the groin, the shoulder, and the neck. We'll put this in until we have that wound all filled up, and we have good contact between the tissue and the gauze. Then we'll put the remaining gauze on top, and then we'll go back to our direct pressure. You're going to have your elbows straight. You're going to push down as hard as you can, and you can push down all the way from your shoulders. You may have to move the patient onto the ground or move them off a piece of furniture onto the floor to ensure that you have enough pressure between yourself and the patient and the floor. This will be very effective in stopping bleeding in those locations.
okay. Oh, boy.
Hey guys, my name's Sam and welcome to Paramedics. This week's video, we're going to be talking about treating massive hemorrhage in the civilian environment.
Okay. All right, y'all's favorite. I don't know how many memes or reels I've got on standard precautions this year, but they are quite funny, and I'm sure y'all love to hear this. Oh, hang on. Everything's embedded in everything. Okay, so, basically, standard precautions are to protect you. We should treat anybody and everybody, if you're handling their body fluid, if it's icky, sticky, green, gooey, and it does not belong to you, don't touch it without trying to protect your hands. Now, I will say the skin is a very good, protection in and of itself, unless you have cuts and nicks, torn cuticles, things like that. But, so if you do get exposed, you want to be sure you wash your hands with soap and water as soon as possible. So hand washing, of course, is the main way. Protective barriers, make sure you're cleaning, disposing of bloody stuff properly, double bag it in a garbage bag, and then be sure you report that incident. So it's to protect us from things like AIDS, hepatitis B, hepatitis C. There are vaccines for hepatitis B. I'm sure most of us have probably had those along the way. You know, infected people may not look sick. People are not may not tell us that a child has HIV or whatever. In fact, I'm gonna say that probably most will not. So we just have to treat everything and everybody. This is the same way when we worked in the hospital. You know, we treated everything like it was contaminated. So, if we treat everybody as if they are infected, then we're gonna protect ourselves and others. Proper hand hygiene is the #1 way to prevent these illnesses. making sure that if you're touching things, you have on gloves. You know, if at all possible, we've tried to make sure y'all all have some gloves. If you don't, you can see us and we can give you some, but there should be some in your backpack. So the recommendation, and this says at least 20 seconds or singing the happy birthday once, but new recommendations are to wash your hands for 40 seconds. We're lucky if we get 20 seconds, but the main thing is just making sure these kids are using soap and water. We're using soap and water because those stomach bugs, a lot of times hand sanitizer does not kill them. The one we had last year, I guarantee you, hand sanitizer did not kill, and that sucker was terrible, and it lasted a long time, and it repeated itself. So we would prefer not to go through that again. I don't know, I know a lot of y'all experienced that as well. Of course, you know, we have the hand dryers, we don't have paper towels, but paper towels are good. So they're not wiping their hands on their clothes, because what's on your clothes? You've washed your hands, you've wiped your hands on your clothes, you've just contaminated them again. So, anyway, we went over doing gloves. If you're gonna pick up something that's yucky, make sure you protect yourself. Then we're going back over wearing gloves. Wear gloves. So, you know, things you've got, you know, snot, blood, pee, poop, whatever is considered contaminated. Make sure, you know, if you have sores and cuts present, that you're wearing gloves. Again. And of course, we know, you know, our lunchroom workers, they are great when they're preparing our food, they're wearing their gloves and things like that. If you're changing diapers, you need gloves. And then to take them off, you got them both on, you take off one, and once you get the glove off of one hand, you grab the center of the glove on the other hand and pull that off, so you're not touching that contaminated glove. So direct contact with infection occurs by contact from person to person. Indirect might be where, you know, that germ is on a desk. You know, where they wipe their boogers all over the top of us underneath, or wherever they put their stuff or their snot or whatever. I would like to say that's probably just elementary, but I venture to say it's probably high school too. Let's see. So if you were to get stuck by a needle, be sure that you let us know. And so we can do a report and follow up with things like that. Hopefully that will not happen, but it could. So we went over nosebleeds. So, you know, if they question you why, it's helpful to explain that you are assisting, that by putting on gloves, you're protecting yourself as well as them from bacteria and germs. Hepatitis B, 30% of people have no symptoms, nor do they even know they may not even know they have it. It's transferred via, it's a virus that goes by body fluids, blood or body fluids. So, you know, we had a conversation yesterday about hepatitis B and the vaccine. The vaccine is good, because, you know, what if you get bit, or a child gets bit, or, you know, you got some fluid exchange that way. There is something out there to protect from the hepatitis B. Okay, hepatitis B, 80% of those have no symptoms. Again, they may not know they have it, so we need to protect ourselves. It causes damage to our liver. And there is not a vaccine for that. HIV, it attacks the immune system, can lead to AIDS. There's no cure, no vaccine. Again, talks about gloves from picking up spills and things like that. Okay, the definition of sanitizing versus disinfecting. So we use sanitizer is a product that reduces germs on an inanimate surface to the levels considered safe by public health codes or regulations. A sanitizer may be appropriate to use on food contact surfaces like dishes, utensils, cutting boards, trays, etc. Same thing in your classrooms that might fall under any of those categories. A disinfectant is a product that destroys or inactivates germs on an inanimate object. A disinfectant may be appropriate to use on non-porous surfaces such as diaper changing stations, countertops, door and cabinet handles, toilets, desks, things like that, to help us keep from getting sick. So we do that. We talked about that. Of course, we know to clean things that look dirty, but we also need to wash those things like our desks and our doorknobs and things that are in high traffic areas to keep our kids well and to keep us well. And then we are working on getting, trying to streamline some of the cleaners and things we use. If you find a needle and you find the cap, don't recap it. I went over reporting exposures. So treat blood and body fluids as infectious, wash hands routinely, encourage students to do the same, use protective barriers such as gloves or, whatever you can grab. We are a school setting, we gotta be realistic. Sometimes we have to get creative. Always clean contaminated areas and dispose of sharps appropriately. And then here's some additional information. Okay. So, all right. Okay, CPR. We are working on being a heart-safe school. This has to do with Project Adam. It has allowed us funding to get these extra AEDs. It has allowed us funding to get mannequins for CPR to practice on. So it's a good thing. It is, Adiana had a situation last year where a coach saved a kid's life because of the training. The child had a cardiac event and the child would have died had somebody not have acted very quickly and appropriately. So what we're gonna go over today is step-by-step CPR, which is just, you check for responsiveness. Are you okay? You're gonna tell somebody to call 911 and get help on the way. You can call them for your phone, put it on speaker, lay it beside you. That's also gonna give you somebody there that can be listening and can walk you through steps of things. If you're in freak-out mode, it's kind of an extra help. And that can happen in any case, for any emergency. We're gonna learn about pushing hard and fast in the center of the chest. You want to do 100 to 120 compressions a minute. And we want to use that AED and follow the preps on it, the responses on it. And those AEDs are so good because they walk you through every step of what to do. So how many of y'all are CPR certified, have a card, and it's not expired? So we got a good many. So we're gonna watch these two videos.
I gave up everything. Instead, these are batteries, my notes, PDFs, and textbooks out loud in clear, human-like voices.
A Save Station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we all understand what to do until medical help arrives, because every second matters.
Zach, you okay? Zach, can you hear me? Can you hear me? Zach, can you go call 911, tell them I've got unconscious male, and report back to me once you're done?
Yeah.
Perfect, thank you. Kate, can you go grab the AED from the safe station? Do you know where it is?
Yeah.
Bring it back to your house again.
Unusual breathing, or gasping, is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
Stay calm. Follow these voice instructions. Make sure 911 is called now. Begin by exposing patient's bare chest and torso. Remove or cut clothing if needed. Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tab corner. Place the electrode on patient's bare chest. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear.
Stand clear. All clear? Shocking now.
Do not touch patient. Analyzing rhythm. Check for signs of circulation. If no circulation, start CPR. Do not touch patient. Analyzing rhythm. Shock not advised.
Breathe
It is
in.
now safe to touch the patient. If needed, perform
Touch the
CPR as
patient.
instructed.
Okay, now we're gonna call.
Zach, you're okay.
Always be on the lookout for the nearest AED, and don't be afraid to use it. Keep up with your CPR and AED skills. Together, we have the power to save a life.
Okay, one more.
If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-on CPR, but know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a teen or adult suddenly collapse, don't be afraid to start hands-only CPR. Remember, call 911 and ask someone to get an AED, then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Okay, so, everybody's gonna get a chance to practice on the mannequins and look at the AED trainer up here. That is part of our, initiative for having all the AEDs and things. That's part of the training we have to do. So, just, remember, cause, what if it's your home with your family member? This could happen, there. So it's not just for here. But the main thing to remember is the quicker you start CPR, the better chance that person has for survival. And, so we want to make sure that we are not delaying care for, our kids, our family at home, or whatever the situation may be. Because that would be, for you to know that to have those skills and things. And that's all we're focusing on is the chest compressions. So basically, you know, if you see somebody collapse or you come up on somebody, you want to look and see if they're breathing, but don't spend a lot of time on it. You know, look for that chest to rise, see if you feel, and then they recommend immediately starting CPR. Hand in the middle of the chest, and you start, you know, pumping 100 to 120 times a minute, singing Staying Alive in your head. And all I can remember is Staying Alive, so. But you want it to be fast. You want to go down about 2 inches, and you want to be sure that, you know, you're letting it come back up and hit the next one, but you want to do it quick to help keep that blood pumping, you know, through there to hopefully, so you can get that AED there, and hopefully once they receive that shock, you know, they'll start breathing again. Several years ago, we were at Southeastern, and one of the officials collapsed on the floor, and we used the AED and did CPR, and, you know, that gentleman is alive today because of the quick response from the people that were present. And so that's, you know, kind of where you hear about it and you see it, and even in the hospital it's a little different, but to be out in public, see it happen, see it work, and see that person survive and have a good outcome was, you know, pretty amazing. So anyway, if everybody we'll do elementary can come up here in high school back there, and we're gonna look at the AED and practice doing some chest compressions.
Hey Teresa, can I say something?
Uh-huh.
On the, I would never have to use the Narcan, but, some students are probably not looking to OD or anything, but as the kids come in and we start to love on them, especially in 7th and 12th grade, we've had incidents with vapes and stuff. But my 28-year-old cousin, was in Louisiana this past September working after the hurricane, and he took something that night before he went to bed, and that next morning he did not wake up, and it was laced with fentanyl. So, they're not all looking to OD, they could just take something, as we all could, that could be laced with something. So, you know, just as you're talking to your kids, as they're coming in and we're going over safety measures and stuff, just remind them that, you know, just don't take nothing from any child. Don't do that to anybody, because you don't know what could be in something that another student's giving you. I just needed to share that with you.
Yeah, Miss Kendra is exactly right. Because they could drink something, they could touch something, they could eat a gummy somebody gives them. So we do, that is a good thing that we need to talk to our kids about, is not taking stuff from other people. You know, it just, we don't know what these kids are going through at home either. You know, we don't know what's in that vape. We don't know what is, in that cigarette, or whatever they decide they're gonna do. So we just need to be alert and pay attention. And, yeah, that young man, you know, lost his life because he, I don't know, maybe he took something to help him sleep and didn't realize it had something in it. You know, innocent, something innocent, and it turned out to be very tragic. So, anyway, and then that's why don't be afraid to use that Narcan either. You know, again, that Narcan, I didn't say this while ago, as with the EpiPen, if you give Narcan and it's not needed, it's okay, it will not hurt them. Now, they may come up fighting like a bear, they may throw up, they may punch, I mean, you know, but just know that that's because that's the way that medicine works. And with any of these incidents we have, whether you use CPR, whether they're choking, or whether they're having a seizure, or whatever, if they lose consciousness, once you get them where they're conscious, turn them on their side, or once you get them where they're not having a seizure or whatever. With all these things where they pass out or whatever, we want to be sure and turn them on their side, because there's always the risk of throwing up. And if they throw up, they may aspirate, and if they aspirate, we have a whole different ballgame. So anyway, y'all come up and let's do some practicing on these mannequins, and then we will be through. Unless y'all have something else.
Let's practice.
Okay, all right, so y'all come up and then go back, we'll